for all of you who are here. Welcome, everybody. I hope you're enjoying your, I can't even say it's the start of summer anymore, can I now? But I'm just going to say it, your start of summer, because I like to think it's going to go on forever. We have a number of topics to cover today, and remain open to your questions or anything that you would like to bring to this Zoom room. So please feel free to put any questions or comments in the chat, or unmute, even better, and talk with us today. So we're going to start out with highlighting some of our new content formats for information about our quality initiatives. And Jana is going to start by sharing with you the preview of our Quality Corner, our summer edition, which really has a focus on pediatric issues, near and dear to my heart. So I'm going to just walk you through what the Quality Corner looks like. This is going to actually be released next Monday. Is that right, Jana? But you get the preview here. And what we're trying to do in this space, I want to give Jana a ton of credit for this in coming up with a format that gives a nice synopsis about some of the initiatives we're working on, provides with you kind of any new or noteworthy new information about those initiatives, and then in a really bulleted and simplified and easy to access format, you get a chance to click on various links and resources. So we're hoping that this will be helpful for our teams. We're finding it helpful with our crew. And yes, Jana, thank you so much for highlighting that. Sarah Dixon has been our content expert in these areas in pulling information together. So many thanks to Sarah as well. So in this upcoming edition, I'm realizing, yeah, you're all going to just laugh at me. This is tiny. And I am old, and so that print that I need to read is, there you go. Oh, Jana, I thought you were going to make it like the big E on the letter chart, you know, on the eye chart. So thank you for increasing the font size for me. So what I'd like to do is just run through each of these topics and give you a little bit of information on each one, see if you have any questions, and then you'll get the whole release early next week. So first of all, for our comprehensive developmental screening initiative and pilot that we've been working on, you know, what's been really important to us is thinking about ways that we can support your practice teams, for those of you that care for children, in implementing evidence-based screening and utilizing evidence-based screening tools at the key intervals when they're recommended, but do it in a way that supports your practice workflow. We know that this is part and parcel and bread and butter really of everything that you do in pediatrics, but it is also very difficult sometimes to implement some of these screening tools if they're not integrated into the electronic record, et cetera. So we've been doing a pilot with one of our AHP practices and looking at some of the different tools and supports that go into the effective screening. And so what we are looking at right now, there are a couple of different screening tools for comprehensive developmental assessment that are recommended. Some of you are aware of the Ages and Stages questionnaire that's recommended, but there's also the SWIC, or Survey of Well-Being of Young Children. Both are approved and recommended screening tools as part of AAP's Bright Futures guidelines. And we actually have found that for the practice we're working with, that utilizing the SWIC has been a more efficient approach to screening. And we've been working on all of the type of details that would make it accessible within the electronic record. So specifically focusing on MEDIT at this time. So you can see here that some of the new and noteworthy features are that we're seeing an increase in pre-visit report efficiency, meaning that actually the providers are getting the developmental screening data ahead of the visit to be able to respond in real time with their patients. So we're excited about this, and we're looking to bring more information to you. This has been a lot of targeted work, really digging into what are the workflows, what are the barriers, how can we make this as accessible as possible, and then we'll begin sharing that out with others. And we're really grateful to the pilot practice who's been working with us in this space. So the other piece I just want to mention, Jana, if you can go back up for 1 second, I just want to make sure people see, just as you look at the links that are the resources and quality links that are shared here. You can actually dive in a little bit and look at the SWIC. You can take a look at the MChat, which I know pretty much all of our practices are using, and they are complementary, or they are not redundant. You still need, and the MChat, we believe, is very important in addition to the SWIC to assure that we're getting autism screening. So, and then there's always, we're looking at making sure that we're referencing billing guidance, so that you all are coding and billing and getting reimbursed for these screens when you're doing them at these key intervals. So there will be links there. Thanks, Jana. Now you can go on. The other thing we're excited to let folks know, some of you may have already heard about this, but in order to really provide as much access to resources for your providers and your practice teams and your patients, we have secured network access to the Bright Futures tool and resource kit. And so I know most of you are aware that really the Bright Futures guidelines are really what they're the roadmap that we operate under in terms of comprehensive screening and assessments across the entire age span for children and youth. But in this space, we really believe that the Bright Futures Toolkit provides such a nice frame and also really provides such nice educational resources for families and even templates for electronic records. A lot of you already use the Bright Futures, but not everyone across our network does. And so we wanted to try to, where there's a really good practice or where there's a really good set of tools, we'd like to make that as available as possible for all of our practice teams. So we can provide this now to you all at no cost to your practice. Again, this really gives a lot of forms and materials related to the health supervision and health screening for all of your. But it's important to note the Bright Futures Toolkit does not include the screening questionnaires that I was talking about just before about developmental screening. What we would like to just highlight for you here is that practice managers can contact Kevin Kelly on our team. Kevin has been the point person for program management, project management with this work, and you can request access for the Bright Futures Tool and Resource Kit 2nd edition. And that will be, there are other resources on here, so you can sort of delve in and take a look at what is involved in that if you're not already utilizing it. And just as a reminder, Bright Futures can integrate into the electronic record, particularly we know for MedEnt, and we're looking at options with other electronic records as well. And then the last thing for me to talk about is re-upping again information to you all about the HPV vaccination Start at 9 campaign. So this is old news, but now we've got new materials for you. The American Cancer Society Start at 9 campaign is well underway now. You may be seeing information in a variety of spaces about this. This is really about emphasizing HPV vaccination as cancer prevention, which is exactly what it is. And so giving a strong recommendation for HPV vaccine start at age 9. We anticipate that this will increase vaccine completion success and prevent more cancers. We're really lucky in our community to have Cindy Rand, who is a nationally recognized pediatrician and researcher around HPV vaccine. And Cindy is also doing a project which we've talked about before, looking at ways to improve practice workflow and thereby HPV immunization rates. So you're going to keep hearing more about this work in this space. But what I'm really excited about, Toby, you are right that NICE still has the recommendation at 11, and we are anticipating that that will be changing. But as with anything, the bigger systems sometimes lag behind all of the other recommendations, but these recommendations are consistent with ACIP, they're consistent with the AHP. All of the national organizations have come on board to support this Start at 9 campaign. I appreciate you highlighting that, though, because we can always do a little advocacy plug, both with the Cancer Society and through our own context there to get that change. So thanks for that comment. So what I wanted to show you here is, we recognize that there are lots and lots of frequently asked question handouts and other tools that are out there. And like we've done in the past, we wanted to streamline what is available and package it in a way that would be really useful for you. Is going to show This is now our just completed and soon to be released, very tiny font, but thank you very much for showing the whole page, Jana. And then you gotta zoom in a little bit for me. I need bifocal contacts or something like that. I don't know. So basically, I'm not going to go through all the details on this. I just want to show you the layout. But essentially, it highlights the updated recommendation, gives facts, speaking points about HPV and HPV vaccination, again, as cancer prevention, goes through a series of the reasons why this is being recommended at this point. And then down below a sample script, like a very, very straightforward sample script that providers and nurses in practices can use as they're approaching families and rooming children at age 9 while child visits. And then the second part of this is really some tips for designing practice workflows. And then also just highlighting some of the key pieces of recommendations if you're doing catch-up vaccination for kids, all those kinds of things where you go digging for that information. We tried to pull it all into one space. So again, Jane is going to scroll through. I'm not going to go through all the details of this. We modeled this in many ways after our old HPV vaccination handout that's been on our website for a long time, which was same day, same way. And the feedback we had received from all of you was that you liked the FAQs, you liked the practice workflow suggestions, and that it would be helpful to have some of those special consideration situations summarized as well. So that's what we tried to do in this space. And then we've done an FAQ sheet for parents that, again, gets at what most of the common questions are. And we hope that will be helpful to you all as you work with your practice teams around this, and then as you share information with families. And that, I think, pretty much captures Quality Corner. So my other topic area, 2 other quick things I just wanted to touch base with you all about as we are entering the back to school time. I know it's not back to school yet, but it sure as heck is for anybody who cares for children in their practice. It's all of the summer physicals, the immunizations, getting ready, the school health forms that need to be completed. We have continued a very close partnership with Rochester City School District and Erin Grotman, who is the nurse who leads all of the health initiatives at the city school. And last year, if you'll remember, Erin helped to spearhead a really just smart efficiency change. And so rather than having practices send the school health forms that include the immunization records and permission to participate in sports and other activities, all those things that are required to the individual schools, but they actually developed a centralized fax repository, a secure fax repository whereby all of those school health forms could come into the Rochester City School District. Because as you may well be aware, and much of this is because it is such a large district caring for so many children and so many different schools, it was very easy for faxes to be coming into certain offices that were not staffed by a nurse during the summer. And so there would be kids who had all of their work complete, but didn't actually have the permissions or the information there. So there's been a lot of tracking things down. So I will just say this is the same fax number that they had last year. It is not a change number, but we are going to be re-upping that information for you. Once I'm done talking, I'll stick it in the chat. But there's a nice letter that has come from Erin to all of the practice teams, just asking if they can make sure in their electronic records, when they're doing automatic faxing or otherwise, that this is the fax that's being used for all children within the Rochester City School District. So thank you for your help with that. Thank you for your work on trying to reach all of the kids and families so that they can start school on time, they can participate in the activities that they want to participate in. We know it's a really big job, so we appreciate your help with that. And then the last thing that I just wanted to mention to you all is that the University of Rochester Medical Center holds a quality and safety grand rounds. And so very relevant to all of our teams caring for children and families. The topic this week, actually tomorrow, This Grand Rounds is being held Thursday, July 13th at 12 noon to 1 p.m. And the topic is assessing and addressing the pediatric mental health crisis. The presenter for this will be Mike Scharf, who all of you know well. He is our Golisano Children's Hospital psychiatrist in chief, and has been working, for many, many years to try to increase access, to increase preventive services, and collaborate with our primary care teams and our behavioral health teams. So I think that this is going to be a really important Grand Rounds, a lot of data and information being shared about what we're seeing in terms of the increases in significant mental health concerns. You all are seeing it yourselves on the primary care end, but I recommend, if you by any chance can tune in, it is both in person and hybrid. So I think that one of our team just put in the chat the link for that tomorrow. If someone did want to attend in person, I recognize that's probably nearly impossible for all of you in clinical practice, but it is being held in the class of 62 auditorium, which is down in the medical school end of the hospital, if anyone wanted to attend from 12 to 1, but I recommend tuning in for that Zoom webinar. And then I'm going to actually just highlight, I made a misspeak a little bit when we were talking about the CDC, and I appreciate, I'm not sure, even Chris, thanks, it was Chris. I was like, somebody put a little correction in there that the CDC is still recommending HPV at 11 or 12, but yes, it can be started at 9. And I think there were no other questions on my stuff in the chat. So I'm going to turn it over to Elizabeth.
Thanks, LJ. So in what I'm sure will be a huge shock to my entire AHP team, I actually am not sharing a slide today. I just wanted to, Robin's laughing at me. I wanted to take just a brief moment to let folks know we have been looking at our quality measure performance. It's something that we monitor on a monthly basis across our different contracted lines of business and for our overall pop health. And we have seen a drop in performance in colon cancer screening from the end of 2022, even just to trailing year April 2023. So in that 4-month period, we saw a very significant drop, primarily in our commercial and Medicaid populations, of about 6%. From a performance perspective, we're still above the 90th percentile in our commercial contracts. Medicaid has seen a dip in the percentiles as well. Our denominators increased pretty significantly, and the age range changed. So this is what we anticipate, what we think is driving the change in performance, the increase in denominator, is the age range to qualify for colon cancer screening dropped from 50 to 45. A full third of our open gaps on their commercial and Medicaid contracts are between the ages of 45 and 50. So for once, in looking at a change in performance, we actually know what is causing it. And that's a really important first step, but now we still need to address that change. So we brought this issue to our PCP advisory committee at the end of June, had a very robust conversation with the docs who attended. We know that access is an issue. There are in places in our network up to a 6-month wait for a colonoscopy. And that is both a challenge in terms of just getting folks in by the end of the year and a challenge in terms of the patients really feeling that this is important. If they can't get in quickly, we know that can be a deterrent as well. And we've heard that the new cohort, so that 45 to 50-year-olds, are more hesitant. A lot of patients out there know that at 50, you go get your colonoscopy. But when you find out at 45 that now you need to get it at 45, there's some hesitancy. It takes people a little while to adjust to the change in recommendations. And so what we wanted to bring here today was just a reminder to this group that that age change did happen. So if you haven't been talking to your patients between the ages of 45 and 50, we would recommend starting to do that. And to let you know it's something we're paying attention to. We did do a Fit Kit initiative. I feel like it was in 2018 at this point. I don't know, it was ages ago. It doesn't seem that long ago, but there was a couple of years that we lost in there to the pandemic. So you will likely be hearing more from AHP in general and from my team in particular around alternatives to colonoscopies, given the access issues that we're seeing, to make recommendations for patients so that they can check that gap, get that care, even if it's not the full-on colonoscopy. If anyone on the call now has any questions, concerns, comments, I'd love to hear them either in this forum, or I know because it can be a little challenging to speak up in front of a large group, feel free to email me. I'll drop my email in the chat. or to give me a call. I'd love to hear more about what's going on out in the network. Because just because we have identified the issue doesn't mean we necessarily know how to impact it just yet. So definitely more to come here. But this is going to be an area that we're focusing on throughout the rest of 2023.
Thanks, Elizabeth.
Thanks, LJ.
Yeah. And I think, Renee, I'm turning it over to you to be our last presenter.
Okay. Hi, everybody. I just wanted to let folks know that we are working right now on generating the payments for our contract participating primary care providers, their first quarter for 2023 clinical integration. So that's that dollar PMPM that we're paying out on a quarterly basis for your attributed MVP and Excelis attribution. So we're working on those payments right now. So you'll get your usual email either from Jana or from myself. It'll have that attached payment detail report. And please don't hesitate to reach out if you see any issues. And of course, we'll be making those payments for most of you electronically, directly into your accounts. And that email is meant to alert you to the payment, and of course, as well to provide you with that payment detail report. So we're looking forward to getting those dollars out soon. You also please be looking out in your emails for some messaging coming from us about 2022 gain sharing, and you'll be getting some information about that very soon. Any questions I can answer, and I can help folks with? We apologize for the delay in getting out those first quarter clinical integration. That always is such a challenge at first quarter because we are sitting here waiting for the attribution data. And then just as importantly, the cash from the payers in order to pay you. So I just want to explain that, that's why we're late on our first quarter payment, but it's coming soon.
Thank you so much. All right, everybody. I'm giving a 5-second, 10-second pause for a moment. And just checking to make sure no one has any other questions. All right. Well, we are going to give you back 20 minutes. I hope that gives you some space, and that we appreciate all of the work that you do. And Dr. Bullard, we can follow up with some of your questions and comments in the chat. I think we can follow up privately and give everybody their time back. All right. Thanks very much, everyone. Have a great day. Take care.